This is a brand new master's program in health professions, pedagogy, and leadership. Many people say, what is pedagogy? So pedagogy means teaching. So it's basically a program focused on teaching and leadership, and it's a 30-credit master's program. So it is a complete master's, and the advanced certificate that we already are offering is a 15-credit program, and it really just focuses on the teaching aspect. This expands the curriculum and the knowledge and skills that someone will acquire at the master's level into a leadership component, which is very common in health professions, that you teach and you lead at the same time. So it's really combining two skill sets that are very important for someone in the health professions who's trying to advance their role beyond their clinical credential they have. Very similar to the advanced certificate, in the master's program, the people that can enroll are people who already have a health professions degree. So that would be a minimum of a bachelor's degree, and it would be in a health professions. That's a very broad category. And of course, anybody who's not sure if they have a degree in a health professions area could discuss it with me as program director, but obviously people who work clinically in healthcare settings generally have some health profession credential, and that's what's required to get in the program. And the reason for that is we're trying to develop cohorts of interprofessionals to come together and learn together, because in the clinical setting, people practice together. So learning together as a cohort of health professionals and then practicing together will be a reinforcement. It's a 30-credit master's, and it's set up with a didactic component. The didactic component, I call it a hybrid program, and the reason it's hybrid is that half the program is online and half the program is face-to-face. The face-to-face course will be offered in an executive model, because I'm assuming everybody in this program is working as a health professional and very busy. So the face-to-face course in a 15-week period will meet every other week for 4 hours. And that will enable students not to have to travel to the campus on a weekly basis. The online course, of course, will be structured as an online course. So people enrolled in the program can take 2 courses a semester, one online and one in the executive model, which will meet for 4 hours every other week. After that, there is also a culminating scholarship project. And I'm hoping that people do a 3-credit, what we're going to call a capstone project. And I'm designing it after a framework of something that would be useful to their professional environment, so they can apply it directly to where they work and who they work with, and then also turn this into educational scholarship or leadership scholarship, depending which aspect of the program they choose for their capstone. It will be flexible, and by scholarship I mean that they'll be able to disseminate it among a professional community that's relevant to the project. That's a very important culminating piece of this program. I'm very excited to be offering this program in the New York region, specifically Long Island, but I consider it available to the New York region because of the executive model of the face-to-face class and then the online class. This is a unique program for the New York region. There's currently no program like this in the immediate New York metropolitan area being offered. There are about 100 of these programs in the United States being offered, as well as internationally being offered. Just to reiterate the importance of what we're trying to do, we're really trying to prepare people to be the best teachers possible in both a classroom, but more in the clinical setting where care is provided by health professionals, and they should be the teachers of these health professionals, to be able to understand healthcare systems from a leadership point of view with an educational lens, and be able to integrate quality improvement into the education that happens naturalistically in these healthcare settings, since most healthcare settings have trainees that are learning how to be health professionals. And then the most important piece is to become a leader from an education point of view and be able to disseminate scholarship related to your health professions degree, and then this aspect of education and leadership. So it's really a 4-pronged goal program that with all the course components, and the capstone project should lead to all of this.